Number 3, Paleo Diet's a fad diet. It's really not, and I'll show you what I think is a great study to justify that here in a minute. But if you look at what most of the world that is non-industrialized eat, they still eat a paleo diet. They haven't fallen into the trap of westernization of their foods. And actually there's a bit of a trend right now in more of your developing countries where some of the Western ideology about food is starting to creep in. They're also seeing a parallel rise in some of the chronic diseases, whether it's diabetes, cardiovascular disease, autoimmunity. Those things are starting to rise in parallel with that. So it starts to make you ask some questions about what foods are being consumed and how those foods affect our body. The paleo diet is the original human diet. It's what man has lived off of for thousands of years. So it's only really in the last probably 150 years where you've seen a dramatic change, and really that change is even more manifested in the last 70 years where you've seen such a significant difference in what man has consumed during that time frame versus what we consumed for all those thousands of years previous to that. The real reason I think this is not a fad diet is the paleo diet doesn't play on a theme. It's designed around real eating real food. Some of your popular name diets out there, they're going to start trying to increase protein, they try to cut out the fat, they try to focus on one aspect, maybe it's sugar, they want to just pull the sugar out of the diet, but not necessarily pulling, say, grains out, which could have an equally detrimental effect. So they really play on a specific theme. The paleo diet doesn't do that. It's really more about common sense food selection. So, you know, as you're thinking about, well, is this the right thing for me to recommend or not? Just trust your gut on it. Is recommending a good, healthy food the right choice to make? Yeah, it's the right choice to make. Here's a study I mentioned, and you can see the date on this. This is a little over 2 years old now. But the Paleolithic nutrition 25 years later. It says, most impressively, randomized controlled trials have begun to confirm the value of hunter-gatherer diets, so the value of your paleo diet, in some high-risk groups, even as compared with routinely recommended diets. So more or less your Western diet there is what we're thinking about. Much more research needs to be done, but the past quarter century has proven the interest and heuristic value, if not yet ultimate validity of the model. So that's 25 years of looking at where Paleolithic nutrition has led us to, and clearly we're seeing some evidence in the literature that it's a benefit to the populace out there as a whole. Number 4, the paleo diet's a diet. Diets have beginning and ends, right? We don't want to set up the concept for patients that you need to do this for a time frame and then that's it. Once you've accomplished whatever your objective is, you know, for most people that objective tends to be weight reduction. Once you've accomplished that weight reduction, then it's okay to start incorporating some of those other principles back in, or some of the other habits that you had. The reason that ideology is wrong goes back to the concept that food's not inert. Food is either inherently good for us or it's inherently bad for us. It's going to promote inflammation or decrease inflammation. Once those principles have been incorporated in, we want patients to hang on to those principles. We want them to continue to implement that as part of their lifestyle, not just as something that they do for a set period of time. Okay? Diets have a beginning and an end. I don't want you to think when you're, if this is something that you end up recommending, I don't want you to think about that we're doing this for a set period of time and then I'm going to lay off my patient. I'm not going to really talk to them about it anymore as long as they're holding in to, say, a certain weight, or their energy levels have come up, that type of thing. Number 5 here, the paleo diet is not ideal for some people. Okay, the myth in that is that eating refined foods is a suitable form of maintenance for some people. I'm here to argue that if you eat refined foods over time, you will develop chronic disease. The literature pretty much bears that out, looking at how those refined foods interact with human physiology pretty much bears that out. It's just a matter of time. Some people will say, well, that guy over there, he's like junk and he never puts on a pound. He will, give him time. He will either put on weight eventually or he will start manifesting a chronic disease. I will tell you the thing that really opened my eyes about that, and the reason I don't emphasize weight anymore, is the first patient I ever lost in clinical practice was a diabetic who was about this big around. He was extremely cachectic, had virtually no muscle tissue, and he fell into a diabetic coma. But he wasn't fat, he wasn't overweight, he was rail thin. So, don't get locked into the weight concept as being your goal for what aligns with health, because there's other parameters, and that's where, as you guys are stepping out into clinical practice, you're going to want to look at these labs and really dissect these labs that are going to feed you back information about your patients on what is the true status of their health. You're taking that look into their body to be able to glean how you need to support them. Myth number 6 here is that whole grains and dairy are needed as part of a healthy diet. Well, if you're looking at sources of fiber, I mean, pretty much if you think about whole grains, the big thing that most people recommend with whole grains is that they're going to have some of your specific nutrients in them, things like your B vitamins, your chromium. They're going to be a good source of fiber for you. Well, if you really look at what the problem with that is, it comes back to this food label that I've gotten over here for you. If you look at the breakdown of the macronutrients, your fat, your carbs, your proteins here, you can see that there's a fairly large discrepancy on this. There's a heavy carbohydrate load, there's relatively no fat in there, 1 gram, and you've got a very small amount of protein in there to balance that out. And you've only got 5 grams of carbohydrates per that, or 5 grams of fiber per the amount of carbohydrate that you've got there. So that's a pretty heavy carbohydrate food. And it doesn't matter whether that is for a whole grain or whether it's for a refined grain. The only difference between that label for a whole grain versus a refined grain is the fiber that's going to be on there. You're still consuming an excessive amount of carbohydrates per the amount of food that you're consuming. The problem with that is that's going to destabilize blood sugar levels, and over time it's going to start promoting excess glucose in the blood, excess insulin secretion to try to maintain control over that. So it puts them on that road for diabetes. Calcium, this is the one everybody wants to try to align with dairy consumption. You can get I won't say excessive, you can get an adequate amount of calcium from your green leafy vegetables, from your produce that you're going to consume. Now, part of the reason that you also don't need to be so excessive in calcium uptake for the average individual who doesn't have some type of osseous malady is that vitamin D has a huge role to play in that. And if you look at what's happening with vitamin D within our population, most people have low vitamin D. And it's really not a surprise. I mean, we're inside most of the time. We're not outside. We're not exposed to sun like we ideally should be. Vitamin D is, if you look at the proteins in the gut that are actually utilized to pick up calcium, they're vitamin D dependent proteins. So having adequate vitamin D is just as relevant to increasing your calcium as anything you're ever going to do with dairy. And here's a study to validate those points. There are no obvious risks, so no obvious risks with avoiding dairy products, margarine, oils, refined sugar, and cereal grains, which provide 70% or more of the dietary intake in Northern European populations. Those Northern European populations aren't that much different in their dietary strategies from what we are. If stroke, coronary heart disease, type 2 diabetes, and cancer are preventable by dietary changes, an ancestral-like diet may provide an appropriate template. So I think that's a pretty profound statement there that emphasizes what we're talking about. So is there really any research behind the paleo diet? So let's look at it from this standpoint for a minute. Let's switch gears for just a second here, and let's look at the problems with the Western diet. Let's highlight those for a minute and then come back to what the role for the paleo diet should be. So if we look at this, you're going to see that the impact of cow's milk is associated with the initiation and progression of prostate cancer. Okay, that's a problem. Dietary intervention in acne. You can see that there's a correlation with the signaling that promotes acne from consumption of a Western diet. And I've given you the references up here so you guys can go and look these articles up and read them in more detail and actually look at the mechanisms behind this if you want to. Overstimulation of insulin and insulin-like growth factor 1 signaling by a Western diet promotes diseases of civilization. Your diseases of civilization are going to be your cardiovascular disease, your diabetes, your cancer, those types of things. Autoimmunity, I guess you could throw into that list fairly easily now as well. And if you think about this, I wanted to highlight the two main foods that I've talked about here. On the left-hand side of this, you're going to see that a high glycemic load. Okay, pretty much all of us are going to recognize a high glycemic load as an excessive amount of carbohydrate consumption, right? And that's obviously going to spike your glucose. It's going to in turn cause your pancreas to want to secrete more insulin. But here's the question. Can you get to that same end result through another mechanism? And you can through dairy. When you look at dairy, dairy is made up of two proteins. You have casein and whey. And that whey protein is what's known as an insulinogenic protein. So it's actually going to promote insulin secretion. And the way that it does that, I'll kind of point some of these things out here to you. The way that it does that is either through leucine, this amino acid that's going to interact directly on the pancreas. It's going to do it through tryptophan and prolactin secretion acting on the pancreas. Or you can go through growth hormone acting on the liver, in turn increasing your insulin-like growth factor, which comes and plays back on the pancreas as well. So you can see you got multiple mechanisms here. And the study that I pulled this from, they actually highlighted the impact that, or the effects of high oxidative stress, so that's your inflammatory component, increased aging, increased acne, and diabetes and cancer. So we're right back to the same endpoints on this. And if we look at it specifically with diabetes, look at the final statement in this study. The Paleolithic diet might be the best antidote to the unhealthy Western diet. I mean, that's pretty straightforward, right? And this is the last study I've got for you, and then we'll get into the case study real quick. But look at this. This is probably the most profound study that I have come across recently. And the reason I think this study is so impactful is because it changes the mindset of it's only about calories, it's only about carbohydrates in terms of just glucose and just insulin. It looks at what are the other problems and how does the consumption of a paleo diet promote health through another mechanism versus a more Western diet that's going to be a detriment to health. And this is what this says. So let me break this down for you. The comparison with the ancestral diets, so the paleo diets, more or less what we're talking about here, and I'll validate that in a second, suggests dense acellular carbohydrates, so grains, promotes an inflammatory microbiota, that's your dysfunctional gastrointestinal tract. And think about what the gastrointestinal tract is. It's the foundational system for the body. It's the system by which everything, all the nutrients, everything we consume enters into the system to support every other system. So if the GI tract's dysfunctional, every other system is set up to be dysfunctional as well. And then lastly, maybe the primary dietary cause of leptin resistance and obesity. So there's your blood sugar problems. So let's look at a couple of quick points here. So just if you want to summarize that, comparison with the paleo diet suggests that grains promote gastrointestinal dysfunction and may be the primary cause of blood sugar problems. But here's some of the findings on this, and stick with me for a minute on this because I think you're going to kind of see how profound this is. Health of those still eating diverse ancestral diets with abundant foods suggests that human energy homeostasis functions well without westernized foods containing flour, sugar, and refined fats. Pretty blanket statement, right? Pretty blatant. Due to being made up of cells, virtually all ancestral foods, so this is where we go back to the living versus non-living. Cells are living entities, right? Have markedly lower carbohydrate densities. Okay, just think about that in real-world application. A zucchini, let's just use that as our example. Zucchini has less carbohydrate density than does, say, a grain of your choice. Just pick one, whether it's corn, wheat flour, whatever. Have markedly lower carbohydrate densities than flour and sugar-containing foods, a property quite independent of the glycemic index. So this is where I said it's not all about blood sugar. And here we go. The present hypothesis suggests that in parallel with bacterial effects of sugar on dental and periodontal health. So just think about, your dentist says, well, don't consume sugar-containing foods because it alters the bacteria in the mouth. It doesn't stop in the mouth. The mouth is a starting point for the gastrointestinal tract, right? So what's happening in the mouth is just a microcosm of what's happening in a larger picture in the small intestine and the large intestine as well. And that's what this emphasizes. Acellular flours, sugars, and processed foods produce an inflammatory microbiota, that dysfunctional gastrointestinal, with fat able to affect a double hit by increasing systemic absorption of lipopolysaccharides. What that means is that the microorganisms that begin to manifest in there cause more of a problem by consumption of those inflammatory foods than if you weren't consuming those inflammatory foods and they were in there acting on their own. These lipopolysaccharides are toxins. You'll see here just at the end the apparent efficacy of the modern Paleolithic diet on satiety and metabolism. So what does that in summary mean? The consumption of grains negatively influences the gastrointestinal tract, while a paleo diet directly improves gastrointestinal health. So again, it's not just about blood sugar maintenance, it has other mechanisms behind it. And there's a couple of other studies you guys can look at if you want to see where it specifically mentions the Paleolithic diet. Now, that's research behind it, right? That's our peer-reviewed evidence. So here's an anecdotal case for you. And the draw date on this was September 30th. And let me preface this by saying that all this patient did was make dietary changes. No change in exercise, no change in medications, no other change in anything related to lifestyle, just dietary changes, okay? So this was her lipid profile. You got a total cholesterol of 293, and you got a triglyceride value of 624, okay? She's got an insulin of 9.4. Insulins that are approaching 10 or crossing 10 in my book are problematic. That patient is already on the trail towards insulin resistance if something is not done to try to turn that back around. And this may not be one you're familiar with, but remnant lipoprotein, I kind of call this a rogue lipid. It's one that kind of acts independent of some of the other lipids, but it has the ability to promote atherogenesis pretty quickly and pretty rapidly. So you definitely want this one down. Okay, so that was her initial clinical picture. On November 22nd, so less than 2 months on this, okay, this was her markers. So we took the cholesterol down 90 points. We took the triglycerides down 452 points, okay. We got the insulin down to 6.2, so we're definitely seeing less of an insulinogenic response from the foods that she's consuming. And the RLP was down at 179, and you can see 150 is where we're trying to get to here. So we were getting her in the ballpark, right? Those are pretty substantial changes for a less than 2 month time frame for somebody that did absolutely nothing else. No exercise, no medication alteration, nothing. So that's what you can, for patients that'll follow through, just imagine what we could have done. If she would have been exercising, we could have definitely made some modifications here as well. So that's anecdotal for you. So what questions do you guys have for me?
What about if you were to incorporate whole grains into the diet in a balanced form, wouldn't you be able to offset the inherent imbalance in a whole grain of having too high of carbohydrates? But if you were to intake that as opposed to some of your, or in lieu of some of your other high carbohydrate vegetables or something like that, couldn't you get some of the benefit from whole grains without having the adverse effect of offsetting your carbohydrate balance?
You could, from the perspective that you're asking the question from. The question I would pose back to you is, what about the aspects of grains such as genetic modification that are completely independent of carbohydrate load? Or with regards to some of the things like I emphasized in the last study where it had nothing to do with the glycemic index, it was completely independent. The effects in the gastrointestinal tract were independent of the glycemic index.
But I thought that was the latter point, the last thing you said, I thought that had to do with the fact that it was an overabundance of carbohydrates that caused those bacteria to flourish and produce the inflammatory LPS.
Let's go back and look at it.
I'm just curious because, your whole life you hear from multiple people, including doctors and stuff like that, that whole grains do have benefits, not that they're the panacea, but beneficial.
Let me state this to even further emphasize the question that you're asking me, because if you go and look, if you just did a literature search on whole grains and look at the effects, there are unquestionably studies out there that will say that whole grains, that show benefits from whole grain consumption, right? That exists. I mean, that's undeniable. But one of the things that you will notice from these is that in a lot of those studies, those patients aren't followed for long periods of times. Some of them might look at things like insulin, but by and large, a lot of those studies don't look at some of those inflammatory markers. It stands to reason, just from going back to basic physiology, that if you're consuming something that is going to have a higher carbohydrate density, then it's going to increase your insulin production. Now, again, the other reason that I don't recommend grain consumption is independent of that as well, because it does go back to, if you look at the food categories that are most problematic as far as being immunogenic and stimulating immune responses, grains and dairy by far are the two food categories that are problematic. You know, one of my colleagues actually said to me one time, and I never thought about it from this perspective, if you look at all the autoimmune conditions that we know of out there, and there are well over 100 autoimmune conditions out there, the only one that we definitively know of what the initiating trigger is celiac disease. It's gluten consumption, right? And if you look at the evolution, the problem with that right now is that celiac disease is it's kind of the extreme case on that, but we know very evidently that people that manifest sensitivities to grain consumption, not just to gluten, that doesn't just manifest in the gastrointestinal tract. As far as to what we know right now, the numbers actually validate that neurological conditions have a higher manifestation from consuming a food that you're sensitive to than gastrointestinal dysfunction does. So, you know, you run into that whole aspect of it as well. And if you stack on top of that the whole manipulation of the food supply, that enhances the likelihood of beginning to react to one of those foods. And to be honest with you, that's probably the reason that there's such a rampant increase. One of the reasons is there's such a rampant increase in autoimmunity right now. I think there's a question over here.
What about foods like cheese or milk, or I mean even like fruit juice? 'Cause that doesn't fit under like the criteria of can we take it, can we find it in nature? But I mean those foods have generally been known as like healthy foods.
Right, and you know it's real interesting because both of you in your questions have talked about traditional mindsets of what has been traditionally recommended, right? And that's the reason that I always tell my patients, if you're not questioning what you've been told by the time you leave an office appointment with me, I didn't get my message across to you. And that's the reason that I wanted you guys to see what the literature says on this. The literature doesn't always line up with what is traditional ideology, and you've got to step outside of that boundary, right? But let me go specifically to your question where you're looking at something like fruit juice. You know, would you be able to find fruit juice in nature? No, right? When you find that what would be as closely akin to that as possible, I'll just use orange juice as the example, you would find the orange. So you're looking at actually consuming the fiber, you're getting a higher nutrient density in that, as opposed to consuming orange juice, which is a refined product from the orange itself, right? And you've got a high carbohydrate load per the amount of food that you're consuming. I mean, just, you know, the label I put up there for the grain, for the pasta, the one for, you know, for a fruit juice is not that much different. It's pretty carbohydrate laden. Whereas if you're consuming an actual orange itself, you're maybe consuming 10, 15, 20 grams of carbohydrates at the very most. So it's not a huge amount. Your question with regards to the cheese, it kind of falls under the manipulation of that food as well. Some of the things that have been done to it. That's a whole other conversation by and large. But if you can consume it and not have issues with it, consume it. But I will tell you, a lot of those symptoms that people tend to manifest with the consumption of grains are silent until later on. I see skin problems all the time that the pulling grains or dairy out of the diet get completely rid of the skin problems. Psoriasis and eczema just go away. So it's one of the big two. If I'm asked to not have the ability to do food sensitivity testings and I've got to make a recommendation to which two foods groups do you have to pull out, grains and dairy have to come out. You've got to pull those two.
My question kind of just had to do with the dairy aspect, because I can see what you were talking about, the nutrition profile of most grains is very carbohydrate rich and lacks a lot of the protein, but in like some of the dairy, like for example yogurt or something that are like probiotic as well, they have a more balanced food, you know, profile where they're protein and carbohydrate and, you know, other sources, I mean nutrient sources as well. So I guess, could you elaborate a little bit more on how dairy is such a big problem?
Yeah, and maybe I came across wrong in the way I presented that. There are some beneficial aspects of dairy, but it's not this is where we have to be the clinician. It's not a blanket recommendation, right? Some people can consume dairy. As a matter of fact, whey protein Whey protein is something I use in my clinic all the time. It has a high amount of glutathione precursors in it. It's a strong stimulant for the immune system. So it has a lot of benefit. If I need somebody to try to preserve or maintain lean muscle tissue, the whey protein is one of the things I'm going to put them on. But in contrast to that, if I've got somebody who I do need to get their body weight down, we do need to control the BMI, however, whatever parameters we're looking at trying to deal with, whey protein is not something I want to put them on because it's insulinogenic, right? So I think you have to weigh the clinical scenario there. But with regards to looking at the profile for, say, yogurt, it's better balanced. It's not ideally balanced. There's still a heavier amount of carbohydrate in there. And if you're thinking about that, well, I'm consuming, now, I'm just using generic. There are some name brands out there that are better, but if you're just looking generically at yogurt, the addition of sugar to a lot of those to make it more palatable actually harms the probiotic strains in there. So the actual probiotic content that you get into that, or that you get from that, it's not very significant. So it's not really the most ideal source of a probiotic. Your fermented foods are going to be far better sources.
What about dark chocolate?
It's one of those things you can consume. I mean, you have to look at if you have the potential for sensitivities, anything like that. It does have high antioxidant capacity. But here's my question with some of the things that you guys are asking is, let me use the antioxidant component of that right now. If you're looking for a source of antioxidants, is dark chocolate going to be the best source of that? Or can you get the same benefit for antioxidants from, say, a fruit or a vegetable and get other benefits at the same time? Because you're not getting any fiber from dark chocolate, and there's higher fat, there's higher carbohydrate in there. So, it is, I see what you're saying. It's probably not going to do anything with regards to, or have any significant impact with regards to blood sugar disturbance because of the amount of fat in it, but is it really the best choice? Probably not. If you want to consume a little bit, if you wanted to consume a little bit, as say like you ate a balanced meal and you consumed a little bit, you ate it as part of a balanced meal, it's pretty negligible in its impact as opposed to eating it by itself where it does have more impact.
Well, and I guess my question is, I think a lot of these questions are just kind of for our own mental sanity to kind of keep in some of these items that are nice to eat. If you eat some of those in small proportions and you keep, like you mainly do paleo, but you do incorporate some of these other items occasionally, like that, is there a problem with that?
I take it back to there's no blanket answer on this. Everybody's different here, right? If you've got someone who, let's say you've got a full-blown celiac, let me just use that as an easy example. Can a celiac have the introduction of gluten at any point? No, not unless they want to have symptoms again. Someone who has, let's say, Hashimoto's thyroiditis, if that's related to dairy or soy, there's a strong connection with soy there. Soy is not something that they should be consuming. For an otherwise healthy individual, which I think is probably the angle you're coming at this from, right? Who doesn't have any known dysfunction or known sensitivity to a particular food, I think about it like this. If you go back to the hunter-gatherer mentality, the hunter-gatherer was probably going to, at some point, eat something that was probably less than ideal for them. They were probably going to eat a bitter at some time, a bitter food at some time. They may eat a little bit of rancid meat at some time because it was all that they had available to them at that point. They may come across a little bit of a rotten fruit, but it's toxic to them. They're going to have a response from it, an inflammatory response, but yet they overcame it. And your body has those inherent detoxification systems to be able to accomplish that. So if you think about that less than ideal food in that same mentality of it's the toxin that you've got to deal with for that short time frame, it's not the routine toxin that you're exposed to day in and day out. Can you handle it? Yeah. Is it the most ideal food consumption? No. But you can probably get away with it as long as the most of your diet is anti-inflammatory by its nature. I will tell you in clinical practice, healthy individuals are not the people walking in the door. So you're dealing with people that are unhealthy that want some health issue resolved. So, you know, the message that I'm giving to you as a young, healthy individual is not the message I give to my patients. I'm a little bit more matter of fact with my patients about it and telling them, look, you can't cheat. Cheating puts you back down the road of inflammation, and inflammation is what led you to walking into my clinic with the complaints that you have. So it's really not negotiable at that point. But, you know, from the standpoint that you're asking me for otherwise healthy individual, you just have to think about it like that. I want every possible advantage in my corner that I can have, and inherently diet either works for us or against us, so I want my diet working for me.
What about those foods or drinks that are not really a source of calories in your diet, like tea or black coffee, things like that? Like where do those fall in this kind of discussion?
You know, probably the best place to put something like that is if you remember one of the early slides I showed that had the plate and it had the breakdowns on it and it had the nuts and the water, but I also put in that list of foods down the side, herbs and spices. It pretty much falls in that category. I mean, if you think about things like your green teas, your red teas, even some of your herbal teas like maybe a chamomile or something like that, there's unquestionably health benefits to those teas. I mean, just let me use the green tea as an example. You know, there's a significant antioxidant contribution from green tea. We know that green tea inhibits the deposition of fatty acids in the liver, and it helps mobilization of fatty acids out of the liver. You know, why would you not want those effects? You know, we would. Coffee's a little bit different animal, only from the standpoint that most people abuse coffee. Most people use coffee for a stimulant. They don't just drink coffee just to drink coffee, right? They don't have 4 ounces of coffee and call it good. It's 16 ounces of coffee and I'm looking for my afternoon fix also, right? So that's not really a healthy approach to it either. But in general, I mean, I think, you know, your teas are a really good example. Most teas that most of us are familiar with are probably going to have some health benefits. So I don't shy patients away from those at all. I actually encourage the implementation of those things.
I have like one more question. Yeah, I'm sorry. But what about the recent rise in nuts as allergens, like peanut allergies and other nut-based allergies? And how would you say that would contribute to this inflammatory versus non-inflammatory food sources?
Yeah, the one that's really highlighted there is peanuts. It's not really much of the other nuts of any significant degree. The peanuts, if you look at them by and large, are a legume. They're not a nut per se. They're not grown on a tree. They're grown underground on small plants, right? Because of that, they tend to, in those shells, because they're not up, they don't have airflow around them, they're down under the ground where it's damp, it's moist, they tend to be able to have fungus grow in those. I mean, if you think about what's an ideal environment for a microorganism, dark, warm, wet, a food supply, you know, so that's probably one of the things that's getting incorporated in there. I will tell you this though, when I do food sensitivity panels with my patients, and generally when I'm looking at those, we're looking at 238 different foods. I'm trying to think the last time I've seen a nut pop up on there. It's not very often. So, you know, I tell my patients if they're coming in and they're saying I'm eating peanut butter, okay, at least they're eating something a little more balanced. So now all I need to do is I just need to introduce them to other sources. Cashew butter, almond butter, macadamia nut butter, sunflower butter, and even the nuts of those things. And you know, nuts are one of those things that, you know, you got Brazil nuts, you got pecans, you got a lot of different varieties there. So I teach them to rotate between those things. Now, if somebody's obviously got, you know, an IgE anaphylactic reaction to peanuts, they got to get away from peanuts. I mean, there's just no way around that, right? But it's the nut category that I try to emphasize the least with my patients because it's not truly a nut. Any other questions? Man, I really appreciate you guys having me in. You guys have had some really good questions. I appreciate that. So, and if there's anything that I can do for any of you, if you have more questions for me, Brian has my email. Any of you are welcome to get in touch with me at any time. I think he was going to send you the presentation. My web address is in the presentation. My contact information is there as well. And there is a plethora of information on there about the paleo diet. So if you need a resource to go to, that's on there. And just like you guys are trying to maintain a science-based approach, I'm trying to maintain a science-based approach. So, you know, the information that you're taking away from that, I want you to be able to feel comfortable with what you're taking and trying to, in turn, implement with your patient base as well, or what will be your patient base. So I appreciate it, guys.
All right, thanks for coming, everybody. Another big hand to Dr. Hill for coming out. So this is just the first part of our lecture series. We're going to be having a lecture or a workshop every